I'd like to acknowledge the local custodians of the land in which we meet today and honour elders past, present and emerging. I'm Melissa Wilkinson from the education team at the Primary Health Network. Welcome everybody. This is our first Masterminds today and it's a very popular one, so glad to be here. Just a bit of housekeeping. The survey will pop up at the end. We really encourage you to complete that for us. That does give us feedback and we can future plan further education events and topics around that as well. So greatly appreciate you doing that for us, and a copy of this will be available over the coming days in our education library with the resources as well. It gives me great pleasure to hand over now to Amy. Thank you, Amy, for being with us, and over to you.
Fabulous. Thanks so much, Mel. And before we start, I'd like to acknowledge the traditional owners of the lands on which we're all meeting on today. I'm coming to you from the Woronara People's Land, and I'd like to pay my respect to the elders past, present and future of the Woronara people and the lands that you are coming from here today. Now, today we've got a lot to pack into this session, really focusing on maximising and optimising the National Cancer Screening Register and how you can access your patient's bowel and cervical screening information. So really quickly, we're going to be looking at what the National Cancer Screening Registry is and the changes that have occurred in the last couple of years. How you can access the register through your clinical software and through PROTA, and how you can utilise the register in your practice to start those preventive health conversations with your patients. Now, as a really quick disclaimer before we start, we will not be going through any clinical information or the specific guidelines around screening. But if you hover over the QR codes for the bowel, cervical or breast screening, they will direct you straight to the Department of Health, and they'll give you all the resources and information available. Anything regarding local health pathways and referral information and support locally, I would like to refer you to the Central Coast and the Hunter New England Health Pathway sites. And specifically for Hunter New England, for referral, you can use your SENT referrals for any management and referral processes. Now, before we get started, and this will make a bit more sense as we go through, it's just a reminder that when you're accessing patient information through the National Cancer Screening Register, it may have been initiated by a GP that isn't yourself or from your practice. So just a reminder, when you're accessing and downloading information, just to be aware and not assume that that clinical information has been followed up on if it's clinically significant. Now, really quickly, what is the National Cancer Screening Register? Now, the register has been in existence for over 20 years, and it focuses specifically on our bowel and cervical screening program. Breast screening has their own individual screening program and register to access. Now, the register previous to this, you could access information and communicate with them through fax, by mail and by the phone. And yes, there are slightly archaic ways of accessing the system, but hopefully after this presentation, you will no longer have to use those means. Now, the register has and still continues to send letters and invitations to anyone who's aged into either programs, and it provides that safety net. So all those reminders for at-risk people continue to be sent with them to remind them to and to encourage them to participate in screening. So the register, as of 2 years ago, started a process to actually integrate with your clinical software and through the healthcare provider portal, which is overseen by Telstra Health. Now, just to be aware that these are both secure platforms to use, very similar to your My Health record system. So it is secure to access and retrieve information from. So really excitingly, this actually allows you to access your patient information in real time. So it allows you to access both bowel and cervical screening results and history for your patients. You can submit any form electronically to the register through this mode. You can manage your patient details and preferences, meaning that you can opt out and defer your patient's involvement in the register. You can update your patient details and, most importantly, update your details as well to ensure that any communication regarding your patient is directly related and sent back to yourself. And really excitingly, you now can order your bowel screening kits for your patients yourselves through both the clinical software and the provider portal, which is really exciting. So before we get started, we have a lot of information to get through. So I do apologise if it's a lot to absorb, but we do have a lot of resources, information and tools and tips and tricks to help you from the PHN side to get you registered for the program. Now, you will note that you may need assistance from the Health Identifier Service or for PROTA, and their details are on your screen. Yes, you can access the register through mail, but hopefully you won't need to look at that and mail off anything after this. And really, as of 2 weeks ago, I would have said to you, if you have any issues and dramas accessing the register, to contact us. I'm not saying that anymore. Excitingly, Telstra Health has actually set up a registered assistance program where you can, from the link on your screen, actually book an appointment with Telstra Health to access the register. So talk through any issues or dramas you're having accessing it. But hopefully after this presentation, we're not going to have those problems. So we are really going to quickly go through the healthcare provider portal first. So it is accessible through your Proda account. Note that if you're wanting as a practice to access the portal, you're going to need your GP to access and register to access the portal before anyone else can. And then your GPs can delegate access to clinical and non-clinical staff members. Being made aware that what's accessible in the register is the exact same for clinical and non-clinical team members, so there is no difference in the information and access or levels of access. So before I show you the next screen, there is a few little details that we need to make sure is correct before you try and access the portal. Otherwise, it will cause a few glitches in the system. So please don't get overwhelmed by this screen. But firstly, we're needing to make sure you have a Proda account. Now, this is for all people that are accessing Proda, accessing the register. But the next couple of sets is specifically relating to your GP who's doing that first registration. So we're needing our GP to ensure that their provider number and their healthcare provider individual identifier number, it's a mouthful, isn't it, are connected. So if they don't know their HPI number, they can contact APRA themselves, and it's that 8003 number. Then they need to log into Proda and go through the prompts of looking at their My Programs, the health identifier tile, and just noting their APRA number, searching for it and saving. That's all they need to do for that component. The next section is that we need to link their HPOS accounts to the general practice healthcare provider individual organisation number. Mouthful once again. This can be checked with either the responsible officer, the OMO, or the organisation maintenance officer, the OMO. And these people are normally the principal GP or the practice manager at the practice. So have a chat to them first. But to double check and make sure this is done, we're logging back into Proda, looking at our programs and a health identifier tile, looking at managing your existing records and following these prompts. Entering the HPI number, selecting search and submit. After these two key components are completed, then you can go on to actually register to access the portal. Like I said, got any issues with those, you can call the Health Identifier Service to talk you through if you don't know those numbers. Now, it's really, really simple to begin with. Firstly, we're logging into Proda, we're selecting the National Cancer Screening tile, and then we're noting that we're wanting to link an account as a Medicare provider. We're then confirming that we're a general practitioner, and then we're wanting to note our provider number as a GP, clicking save and linking. That's all we need to do, and then we have access to the National Cancer Screening Register through the portal. Now, after that's done, clinical and non-clinical staff members, like our nurses and practice managers and reception staff, can ask for delegation. So they're logging back into their Proda account, selecting the National Cancer Screening tile, and then we're wanting to state that we're a practice staff acting on behalf of the healthcare provider. Then we're wanting to request delegation by noting the GP's provider number, selecting save, and then requesting that access. So that's all that needs to be done. So when a GP then logs into the portal, and we'll have a bit more of an overview in a second, what they'll see, which is on your right hand of your screen, is that they log in, they go to My Profile, Manage Delegation, and it'll come up with a list of all the people who've requested delegation. And it'll allow you to allow or deny. So obviously when your staff leave the practice, then you can remove and revoke that access to the register under your provider number. So we're logging into the register, and this is what you'll come up with and see. It's very simple, it's very straightforward. So we're needing the patient's Medicare number, the family and given name, date of birth and sex. Then we're just searching. And it comes up with the below screen. So depending what program they've aged into, you'll be able to toggle between the bowel and or the cervical screening tabs. Both look very similar, but with one very distinct difference. So here is just a really quick overview of the patient's details. And if any of those details are incorrect, you can go into the My Participant Details tab and you can amend any of those details, including your details. It gives you a really brief overview of their last screening date and when they're next due. If it says due now, it means that they are overdue and they need to commence screening straight away. So in the correspondence tab, that is where all the correspondence that any healthcare professional has submitted to the register and anything the register has corresponded back with the patient and the GP. It is all sitting there, and it's a very comprehensive view of what's been sent to the patient. Now, the form section is what you can see on your screen right now, which is quite the exciting bit. So it actually shows up all of your patient's screening history. Now, we are looking at the cervical screening tab here, and it's showing all of our screening history. Now, on the right-hand side where it says Action and View, you'll be able to click on that link and download the patient's most up-to-date screening details. So it's that full comprehensive pathology report. Now, at this point, you will be able to download, put into the, your GP's inbox, and then follow your current systems and workflows to actually have that correctly reported and reviewed in that patient's file. And we're adding recalls and reminders as we see fit. The only difference with the bowel is that you'll have an option next to choose a form to actually request that bowel screening kit, which will go directly to the patient's address, which is noted within the portal. So it's a really quick overview, but we'll go into more detail about it in a second, but we'll transition over and look at how we can actually integrate our software. So the software integration at the moment is with Best Practice Medical Director and Communicare. So any practice that uses ZMed or Genie, I implore you to utilise the healthcare provider portal. There is nothing different in the information and the access to the National Cancer Screening Register. It's just a different platform of where you can use that information. So once again, there's two steps for this one, and there's a little bit that needs to be done before you start that integration in your software. So your practice needs to register for the clinical system integration, and that needs to be done by your practice manager or your responsible officer, who that person is, and must be done as a first step. Once that's done, you can chat to your IT provider and to get that the National Cancer Screening Register function enabled within your clinical software. So ensure that you do that first step and register before you engage with your IT provider or whomever in your practice provides that support. Now, this is the job of your responsible officer, is that we're firstly wanting to make sure our clinical software is up to date. So the most up-to-date version of your clinical software. Your responsible officer has a PROTA account, and yes, they need to be an associate or an authorised person against the Australian Business Register. Please note that this is a bit controversial. We understand that a lot of practice managers wouldn't be noted on the business register, but it needs to occur for that integration to occur. Please note your responsible officer can be your principal GP of the practice as well, if that's going to make things slightly easier for you. So after you've ensured that's been completed, you need to complete a one-time registration to access the register by your responsible officer via PROTA. Now, of course, there's two options to do this. First is for your first-time users of the healthcare provider portal. So you've never accessed it, you've never registered to use it via PROTA. Your second is for those who do have access to the register and via the portal. And it is really, really simple to do this step. So for first-time users, we're logging into PROTA, we're selecting that National Cancer Screening tile, and then we're looking at our fourth option where we're wanting to register the practice. We're noting then our practice HPO number, then we're confirming all the details and making amendments. We're wanting to agree to the terms and conditions, select save and register. And that's all you need to do. And at that point, you can actually contact your IT provider and get them to start the process of integration. For existing healthcare provider users, you just need to log into your account to access the National Cancer Screening Register, jump up into the My Profiles tab, then select the Manage Your Practice, and then there'll be an option to register your HPO number. You add that in and you register. And once again, you contact your IT provider to start that process. Now, all of these are hyperlinks, and it is quite dense in information, but Best Practice Medical Director and Communicare have their own ways of actually integrating that software, noting that Best Practice and Communicare have that extra step within the software to ensure that is enabled. All of these hyperlinks direct straight to where you need to refer your IT provider. I'm sure that they're already aware of this, but just be aware you need to follow these steps quite clearly. So once that's done, All three softwares actually have the exact same information, they just look different. So you can contact the register and upload any communications or forms. You can request that FOBT kit, you can look at any screening results, you can download them. The only difference with doing it through clinical software, you can download them straight into that patient's file, as opposed to downloading them to your desktop and importing them into your investigation reports like you would for the portal. So best practice, it sits up on that top tabulated area, and it's called the NCSR Hub, and it's downloadable to look at for any patients that's opted that is aged into either cervical or bowel screening. For medical director practices, that sits in your widget. So where the My Health record and where the you send referrals widget sits, it sits right there as well, and which you can just pop open in front of that patient screen. The Communicare practice is slightly different, and it sits up in the right-hand corner in that big red alert section, and then you can just populate that out and it will come up all your patient details. Now that is a really quick overview of how it looks, and I say it's really quick because we only have a very short period of time, but we can work through this on an individual level as to how you can utilise and how it works for you in your practice if you'd like to later on. It'd be remiss of me if I didn't mention the most recent portal development that's available for everyone that's aged into the program. So your MyGov account, you can now link the National Cancer Screening Register through My Services, and through this portal you can look and review your personal details, you can nominate your healthcare provider, so your GP or specialist, you can check your screening history, so when you were last screened and when you are next due for screening, and you can request that bowel screening kit. Now, please be aware there is no clinical information that is held within this portal. It is basically just stating when they had their last screen and when they're next due for screening, and all that clinical information is sitting within the healthcare provider portal in the integrated system. So now that was very quick and condensed, but you do have access to the register and you know how to access it. So how can we actually use it in our practice? So there's really two key approaches of how you can use it. One being the opportunistic, so our real-time approach of utilising the register with our patients. The second is that systematic data cleansing. And I know everyone sort of rolls their eyes at data cleansing, but this is a really effective, focused approach of actually improving that communication with your patients and improving your participation rates with the register. And we'll go through that shortly. Quickly looking at our opportunistic approach. So this can be done through any means of contact with your patients, meaning your face-to-face consults, your video and your telephone consults. There is no restriction because we can access this in real time. We can include cancer-related screening questions in our new patient forms, in our new patient consults, so we can quickly look to see if they're due, overdue for screening, import those results into their patient file, and if necessary, have a conversation about screening. Now, when I say we're importing results, I'm saying you are following your workflows and your systems to actually import results into your patient files. We can include cancer screening into health assessments where it's appropriate and to add those questions. We can include it in our 715 health assessments. We do now know that our First Nation people are screening less and have a higher comorbidity of cancer. So we're really wanting to use this opportunity to have those conversations with our patients and utilising the register to see when they have last had their screening and when they are due. Similarly, for our GP management plans, where it's appropriate and eligible, you can have those conversations as well. And just be mindful that we do have those nurse item numbers to utilise both for our 715 health assessment and our chronic disease management plans. So you can look at how you can integrate preventative health and utilisation of the register through these conversations. And of course, we have our actions, alerts and our prompts that we can utilise and maximise our software to remind our GPs, our nurses, whomever it may be, to quickly review to see if that patient's due for screening. Also, we can use that as well to send off that FOBT kit to the patient as well. So if they haven't had it done, you can have that conversation and get it sent to their address. Now, our systematic approach incorporates everything in the opportunistic list. So it's a bit more work, but it focuses really heavily, of course, on our data, and for most practices, it's your pen tool. So what we can do with PEN, we can identify our patients who are under-screened. So I've identified in our PEN tool that they are under-screened, so they haven't been screened within those parameters of our clinical guidelines. But first, we want to discuss our area of focus. So what patients we're wanting to focus on. So for example, do we focus on patients that are aging into the program? So for example, our cervical screening from 25, do we look at 25 to 30-year-old patients to have those conversations with them, to educate them to commence their screening life on a positive note and explain the changes to the HPV screening, so we actually have that really good communication with them from the first steps? Or do we look at patients who are 70 to 74 who are aging out of the programs and need to have that exit screening? We don't want to miss them. Or do we look at our First Nation people within our practice and their screening? Or do we break it down by cohorts and look at certain cohorts who look like they're under screening or underperforming against other areas? It's absolutely up to you. It's for your practice to determine. But then after we've done that, we want to send effective reminders to our patients by utilising the register. Now, just to put a bit of icing on the cake, everything that we do and that we can do with your practice, and we being the PHN, we have tools and resources, guidelines, flowcharts, templates, PSA cycles to work with you on this. It's all underpinned by the quality improvement requirements, specifically for your cervical screening, but noting that any quality improvement you do within your practice relates back and qualifies you for that QIPIP. Obviously, our accreditation standards, specifically our quality improvement, but looking at things like our information management and comprehensive care that we provide our patients. And lastly, our My Health Record PIP incentive, where our requirement is that we're working towards quality data records and clinical coding. So let's have a look at how we can use CAT4 in that systematic approach. Now, I will go through this really quickly. I know we're nearly out of time, but like I've said, we can go through this at a practice level to personalise this to you on your practice and your workforce and how you want to provide your care to your patients. So for this example, we're using the cervical screening. And for this activity, we're looking at our active patients, which is 3 times in 2 years that they visit our practice. Now, be really mindful that our cervical screening register and our guidelines have stretched to 5 years. So this search will not encompass all of our women, all of our people with a cervix who have attended our practice, but just for this activity, we're looking at this patient group. Now, in our population, we have just over 700 women people with a cervix who have not been screened or have nothing recorded against their record. And we all know that is unachievable to look at. We're not going to get any traction with our staff to look at those patients. So we've had that conversation as a practice, and we've decided to look at our 25 to 30-year-old people with a cervix. And it's been noted that we have 107 people that have nothing recorded in their file, meaning that they could have gone elsewhere, they could have been screened by women's screening, and the results just haven't been imported into their file correctly. Or our people who have not been screened, have been screened previously by the PAP register, but not by the HPV screening. So we're really going to quickly agree on a time frame of what we're going to do with these 107 people. You can't expect that to be done in a day, but we're going to say over a month, we want these 107 people to have their record reviewed on the cancer screening register, whoever's doing that. So breaking it down, that's little more than 20 a week for a day. We're going to access the register, look at their results. We're going to follow our current workflow and systems and have those results reviewed and recorded and placed in our patient's electronic record properly. Then we're going to send a reminder. So sending a reminder, let's say 70 of those patients had a screening done elsewhere, and we're left with 37 people to remind. So now we know that we're actually effectively reminding them that they're due because of the fact that they haven't been screened elsewhere. And whatever mode that is, via phone, via text message, via letter, we're wanting to make sure that that letter is effective, reminding them that you have a women's screening nurse, or you've got a new GP on board, or you're focused on women's health, whatever it may be, make that reminder effective. Once that's done, we repeat the process. Now, when we're sending the reminder, I must mention, if you're sending 37 reminders to people about their cervical screening because you're confident that they are overdue, you need to make sure that you have the capacity and capability that if 37 women respond and say we want an appointment, that you're not giving them an appointment in 6 weeks' time. We want to actually have that momentum continued. So do you send 5 reminders? Do you send 10 reminders to begin with? Whatever system works for you, you employ that one. And then we repeat and select our next age cohort or our population of patients. Now, I have gone through a lot of information probably just on 30 minutes, and I know that it's been very condensed, but what I want to really stress to you is not to stress. We have you covered. I have mentioned a couple of times that we have resources and workflows, we have quick sheets, we have PSA cycles already done for you, and we can personalise the use of the register to maximise your impact of improving screening in your practice. We know that COVID has had a dramatic impact on all areas of healthcare nationwide. We know that screening is one of them. So if this is an area that you want to take a little bite-sized chunk out of and start working towards, or if you want to create a whole entire system, that's what we can do for you. Please email me or give me a call if you've got any questions or any dramas. But I'm pretty sure we're probably hitting just on time, Mel, but please shout out if you have any questions or any dramas, and I'm more than happy to talk through that with you.
Thanks so much, Amy. That was great content, and you've covered so much. That was a wealth of information. I'm sure everyone really appreciates that. There hasn't been any questions that have come through so far. So, there is one now. A big thank you from Tammy. So thanks for that, Tammy. So like Amy said, if you've got any questions, if you could please just send them through to her directly, that would be amazing. I want to thank everyone for being here with us today, and really appreciate your time and company. And until the next one, the flyer will be coming out very soon, later on this afternoon, for our next mastermind, and hopefully we'll see you all then. Thanks, Amy.
You're welcome. See you. Bye.